Now we'll look at using the PPEs in a radiology department or in a radiology lab, so to say. So PPE, we're trying to talk about what is a PPE, and also we're trying to talk about what are the importance. Why should I actually use a PPE in a radiology department? So what we got is this. This is what a PPE is, and it has to do with the overall protection you get when you are in the lab, protecting all your body parts and all of that. So what we got is this. Purpose of PPE in the first place. Why should I wear the PPE? So it serves in two main purposes. It protects the staff, and also you can give a PPE to a patient, you understand, and to also protect the patient from unnecessary radiation exposure. So it also prevents cross-infection, infection moving from the staff to the patient, or infection moving from the surfaces to the patient, or infection vice versa to the staff too. Do you understand? So that's just what we got. Common types of PPEs. They're just trying to talk about all these types: the gloves, the apron, you understand, the face masks, the rest of it. So we have the lead aprons, we have the thyroid shields, usually used to protect the thyroid gland. We have the lead gloves, we have the lead glasses, we have the dosimeter badges. Those ones will kind of like be monitoring cumulative radiation exposure for staffs. Then we have face masks, we have non-lead gloves and gowns. Then we have the radiation barriers or a protective screen. Okay, that's what we got for that. All right, so this is another image which you get to actually look at what's the PPE. This one is an X-ray protective lead clothing, so it's made from lead, and it's specialized for that role. So best practice for PPE use is always wear aprons and thyroid shields when assisting in anything fluoroscopy or portable X-rays. Inspect the PPEs very well, because you don't want to see that there's any you don't want to see that there's any cracks that radiation could still go through. Then use dosimeter batches consistently for tracking exposure. Combine PPEs with 3 core radiation safety principles. You have to minimize the exposure and the distance between you and the PPEs is kind of like far, and use shield effectively. Apply infection control when PPEs, so when working with that. So importance of PPEs in radiation is this: you safeguard the staff health by reducing long-term risks like cancer, ensure that the patient is safe, and particular where staff must remain closed during pediatric or trauma imaging. Then also keep maintaining with the overall hospital safety standards.